different, right?
Hi, it's Dr. Noel Williams, Optimal Health Associates, June 2nd, 2021. And let's start with the simple thing. COVID's essentially over, okay? In the United States, in Oklahoma, we're down to under 50 cases. Now, when I'm saying over, I'm talking about the pandemic. There's still gonna be infections, but that isn't what destroys society, it's pandemics. So the pandemic is over. And the people getting infected are the people who have not gotten vaccinated. No one's getting reinfected and sick. No one is getting, none of that's happening. It's people who haven't been vaccinated. So this is a plea. If you haven't been vaccinated and you're a high-risk group, and I'm not saying that everyone's, the CDC says everyone should get vaccinated. I'm just asking people at this point, if you're in a high-risk group, really think about it. If you're over 60, get the vaccine. Really strongly consider it. I'm gonna give you an alternative in a minute if you don't want to, but really think about it, because that's what we're seeing. We're seeing people in high-risk groups get sick still. I had someone in my practice who got sick this last week or two. They're fine now, they're gonna be fine, but it was a little scary. I didn't like it emotionally, and we got them through, I helped get them through it, but that was the point, was I felt scared for them. And I don't like that feeling, because we don't want our patients to ever be in a position where we can't totally fix it, and it's upsetting. And so don't put yourself in that situation, because I don't want you to get sick and I don't want you to have problems. And so do that for yourselves. And then if you're someone with multiple medical problems who's younger, meaning over 30, or if you're obese, get the vaccine. Now the CDC would have everybody get that vaccine. I'm not arguing with that, but I'm saying at least if you're in the high-risk groups, really strongly consider it. If you haven't gotten it yet, because you've been obviously ruminating about it and thinking about it for a while, or you've decided not to do it, so reconsider. But if you're dead set against the vaccine, do the simple stuff. Get your tetanus shot. Get an MMR, measles, mumps, rubella, caught up. That's gonna give you a really good cross protection. And for those of you who don't understand that, who are not lay people, but who are doctors, read a journal article and you'll understand. And sometimes I'm a little sensitized because, I get a lot of criticism for posting, which is very interesting because it's from people who don't read, don't think, and don't understand. And I had a story today and it was about a physician complaining bitterly about me to someone else that is pretty good friends with me, and saying I'm a quack because one did COVID posts and talked about nutrition and do that, and why would a gynecologist, and I'm basically a giant ass. And I was like, he doesn't even know me. He's never met me. And I thought, who thinks nutrition doesn't work? Nutrition works for all kinds of diseases, and it absolutely worked for COVID, and there's hundreds of journal articles. 2, people with a brain can get out there and try to help people. And that's gonna be the thing I'm gonna ask all of you to do moving forward the rest of your life after COVID. Take a stand on stuff. Make a difference. Try to help people. And ignore the people who, when you can, you get affected. Ignore the people who criticize you unfairly, because they're just usually, don't read, which is a big criticism. So anyway, the key thing is challenge yourself moving forward with COVID to be a lighthouse of truth, a lighthouse of reconciliation, and have fun and be humorous and don't take yourself seriously and get rid of this woke society baloney and which makes Kim laugh, and just be like normal people and make fun of each other. I don't know what else to say about that, but so I'll still be talking about COVID a little bit here and there, other than, I will be making fun of Fauci because he's gonna go down like a sunken ship. But hey, it's okay, because all the stuff he's been wrong about is gonna become clearer and clearer, and history will validate all that, but blah, blah, blah. But we're gonna start moving on to other subjects. So I'm gonna be doing posts still, we'll mention COVID, but I'm gonna be talking about health. How do you stay healthy? What do you do to stay healthy? What interesting new things are out there for everyone that can make them do better? And what are they besides, medicines, which I have to take a atorvastatin for my horrid cholesterol, but I combine that with, bergamot oil and berberine and fish oil. So I have to take a statin. Some people have to take statins because their cholesterol is so horrible, but you can do things to help. And so that's what we're going to be talking about. We'll talk about ozone. We're going to talk about ultraviolet light. We're going to talk about stem cell derivatives. We're going to talk about nutrition. We're going to talk about cold water immersion. We're going to talk about things that you can do to help yourself feel better all the time, lengthen your life, and have more joy. Then, of course, my favorite subject is hormones, which is part and participle of everything for all patients and people. So anyway, that's what we're going to talk about. But Kim, any questions or comments? Am I forgetting anything? I'll post some stuff about nutrition in the next few days. And again, for COVID, just for those of you who want to see the validation of everything that we've talked about for the last 18 months. Because to be clear, in terms of all the scientific stuff that's been related on my posts and stuff, so far it's been pretty, I would be very self-critical. I was totally wrong about Trump, thinking we were just going to close the country, but on a scientific fact, it's everything that I originally said back in February through today has been correct. And the one thing we'll see over the next 6 months to a year is that if you've been infected, you have long-term immunity, and don't do a booster. Don't do it. And no one who gets the vaccine should get a booster until they prove you need it, because you have immunity. And that's what the CDC's shown, but the booster thing's all about making money for drug companies. So don't buy into the booster stuff. I'll periodically mention that. Take your vitamins, take your fish oil, live a healthy lifestyle. That's what COVID prevention's about. It's what flu prevention's about. It is how you stay healthy. Anything else, Kim?
I didn't know we were going to film, so I didn't prepare. The only thing that I would say is every once in a while, you mention journal articles, and the people that aren't clinical.
Journal article.
Yeah.
So a journal article is a peer-reviewed, published, usually, or pre-published, preprint article. And the thing to know about journal articles are there's different gradations in terms of what they mean and how you interpret them. And the key concept is when you're looking at data on how something works, that is a different type of journal article than a clinical trial saying, I give drug X and I need to see this level of improvement. And I think a lot of doctors forget that, actually, very clearly, some of the messages I get. If you do a study like the one I talked about with the long-term immunity on people who got infected with COVID, and you look at 50 people, and then you actually study down 18, and all 18 have long-term immunity, that's a really good study, and which is why it was published in the journal Nature, and it shows long-term immunity. They don't need to do 500 people. They're looking at enough people that are a random sampling. And when you correlate it to multiple other trials showing the same thing, and then you correlate it to the National Institute of Health's own study, and I'm talking about the written post I did a few days ago, about a week ago, that shows T-cell immunity, somehow saying that there's not enough data makes no sense. Because then you take the basic science stuff, which showed long-term immunity with prior infection, the basic science, then you go to population data. So the population data shows there's virtually no reinfection that's symptomatic. Okay, I mean, again, I'll go over this slowly for those people who don't understand, which are not, most people, it would be more people with advanced degrees because they can't listen, but it's 10% of people get reinfected who get COVID. 90% of them are asymptomatic. This is the best trial, and it's a large trial, but all the other trials show the same thing. Of the 1% that's left, 99% of them have minimal infection, minimal symptoms. I have my eyes itch, my nose is itchy, I get a cough. I'm not symptomatic enough in any way, shape, or form that I would even really think I was sick. And it doesn't affect my functionality, my athletic performance, or anything at all. You have nothing. So you get to 99.99, probably 99%, or essentially 1 in 100,000 for mild symptoms, 1 in a million for severe symptoms, 1 in 6 to 8 million for death. And it basically works out the same for the vaccines, at least the Moderna and the Pfizer, but essentially all of them. So the bottom line is this: we're done if you've gotten infected over 99.999% of the time. And safetyism, which I've talked about before, there are gonna be risks. When I get off this and go down my stairs, I could fall down which some people would like, break my neck. But it's unlikely. Just like it is incredibly unlikely to get COVID again. Safetyism means you can never have a bad thing happen, which means you can't function because you can't eat, you can't drink, you can't just sleep, you can't do anything. And so that's not where we want to be, and that's what the CDC and the NIH has done to people and the media. And the media is retracting slowly. They're retracting everything they said about it not being from Wuhan because, okay, it is probably 99% of the time. Remember, there's never been, just as an aside, separate from the basic concept that it's from Wuhan, is that they have not found an animal vector. They have not found the virus, the original form of the virus in an animal, as an animal source. They did with SARS and MERS. They haven't. I mean, there's just so much collateral data. And it's the same thing with the population data in terms of reinfection. So anyway, that's a summary. Be glad we're done. We'll go over other stuff. We have a great summer here in the United States. Europe and the rest of the world will be caught up probably in the next 6 to 12 months. Unfortunately, it's going to take them a while to get caught up. Hopefully, we'll be getting all of our vaccine overflow that we've produced to Mexico, Canada, and Central America, and South America, and the rest of the world as fast as we can. And not dwell on doing boosters until we get the whole rest of the world vaccinated. Again, I'm not for boosters, but boosters are important in the United States because there's money in boosters for big pharma, and that's why they're talking about it. They don't give a rat's you know what about boosters anywhere else. It's to make money off the federal government because that's what it's about at this point. So no, we need to get all the focus on getting the rest of the world vaccinated. So anyway, take care. Have a great early June. I'll post some written stuff this week. And the final thought, which I should have said first, is if anyone has a topic they want me to go over in medicine, I'm happy to do so. I'll research it if I don't know about it, and I'll talk about it. So happy to do that, and I'll start mentioning that in all my posts. If you have a topic you want me to review, I'll get to it eventually. So send me message me. You all take care. Bye.